quorum present, and I believe quorum is intact. Is that correct, Brian? All right, the Maricopa Regional Continuum of Care Board is now called to order. Please turn on your microphone when speaking and mute when not speaking. The MAG public comment process allows members of the public to comment on items on today's agenda or on items that fall under the COC's jurisdiction. If you'd like to comment at today's meeting, please fill out a white request to speak card by the door and give it to MAG staff. If you parked in the garage, parking validators are available by the door. If you purchased a transit ticket to come to the meeting, please see staff for ticket. Hearing assisted devices are available from MAG. Brian, please take roll call and please share your name and that you are here and the organization you're from.
Letitia Brown Gambino. Tim Birch.
Tim Birch, Tempe here.
Jessica Cruz. Liz DaCosta. Chris Hallett.
Here, City of Peoria.
Michael Hughes. Jessica Raymond. TJ Reed.
Here, Maricopa County.
Charles Sullivan.
Charles Sullivan, ABC Housing here.
Sienna Valdez. Cricket Weatherington.
Here, Arizona Housing.
Danielle Wright.
Here, Danielle Wright, Arizona Coalition and Sexual and Domestic Violence.
Co-chair Rachel Milne.
Here, City of Phoenix.
And co-chair Vicki Phillips.
Here, Community Bridges. Okay, the next item on the agenda is a call to the audience. This is an opportunity for the public to comment on items that fall under the Continuum of Care Board that are not on the agenda or that are on the agenda for discussion and not for action. 15 minutes will be provided for the call to the audience agenda item unless the committee requests an exception to that. Brian, were there any comments received or anyone who wishes to comment at this time?
There were no public comments received. And I don't see any requests for public comment at this time.
All right, thank you very much. We'll move on to the next agenda item. Our next item is the approval of the consent agenda. Items 3A through 3F are on the agenda for consent. Does any member of the board have questions, comments, or request a presentation on any of these items? No. Does any member of the public wish to comment on any items on the consent agenda? All right, may I have a motion to approve consent items 3A through 3F?
This is Rachel, so moved.
Thank you, Rachel, as a first, and may I have a second?
This is Chris, second.
Thank you, Chris. All right. Is there discussion of the motion from the board or any comments from the public? All right. For those in the room, we will take a voice vote. Those in favor, please say yay.
Yay.
Okay.
Those opposed, please say nay. All right, Brian, would you please proceed with a roll call of those joining online?
There's currently nobody online right now.
All right, very good. The motion passes and we'll be moving on to the next agenda item. All right. Next up, we're going to have a report on the 2024 regional point in time count. This item is on the agenda and it's an update on the point in time count. I'll turn it over to Brian from MAG to present on this data. The item is for information only. Information and discussion, sorry.
Hey, Tyler, can you log me in? I'm on Zoom waiting. Or if not, just switch. We can pull the PowerPoint up on your end. Mm-hmm. I'm just logging in now. All right, folks. Here we go. Point in time count. So, as a refresher, everybody remembers what the point in time count is, but HUD has us do these. Technically, we do them twice a year per HUD, but we do them an extra year because it's better for our NOFO scores. Just about everybody in the country does them annually, not biannually. The data, it helps us determine the amount of funding. We like to think of this as a bottom line or a minimum number, right? We know from doing this years and years and years that the technical numbers don't really give us the ability to track at the granular level that some of the other data that we keep does, but it is still, it's a baseline number, and we use it as such. It comprises a shelter and a street count, gives us a bottom line number that we'll be reviewing in just a second. And then everyone in the country does these at about the same time every year, which is in the last week of January. So what happened this year? Well, as everybody will remember, it was super wet. It was raining the day of the count, leading up to the count, and the night that we actually conducted the count, or that people slept out. So that was the 22nd of January. And then when everybody went out that morning, it was still raining. One of the main things that we saw this year was a shift into shelter. So the unsheltered numbers went down, sheltered numbers went up. We also saw some changes in our race ethnicity composition that we'll be reviewing. And then we'll talk a little bit about changes that we had made this year to the methodology of the count that I think are worth noting as we go into our next year's planning. So, dun, 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 here are the numbers. If you look on the far right, you'll see 2024's numbers down slightly. So about 200 fewer people counted this year. And you know what I should say real quick before anybody pulls out their phones and starts taking pictures, we are not releasing these officially via press release until Wednesday, because that's when we are going to show these to all the mayors and whatnot at the regional council. So if it's possible to refrain from sharing these broadly, we would appreciate it very much. We will not be posting these numbers on the website until then. But again, Wednesday, the press release goes out. So main things to note. So slightly lower percentage overall, 2% down from 9,600 to 9,400 and change. The big deal is that we saw lots of people moving from unsheltered and into sheltered. And to get a little more specific, here's what we saw. So, we think really that this reflects a 2-year effort, concerted effort to develop more shelter. So I think, as much as we try to downplay the point in time count as like a stamp, this is what we're doing, these are the successes and failures and so forth writ large for the whole COC, I think it is worth celebrating that we were able to move a lot of people off the street and indoors. And I think that directly reflects the efforts of communities that are out there building shelter and making that investment. So moving on from there, and I'll just say right now, if folks have questions, we can go back over any of these numbers after the presentation. The race ethnicity thing, it came up. This is one of those things that we probably wouldn't get into the weeds on. It's just a method question, but it did result in a pretty significant change in some of the race ethnicity composition. And it's worth reviewing what changed this year. So in 2023, we used 6 standard racial categories plus ethnicity for reporting purposes. HUD changed that this year. So instead of 6 categories, which kind of looks like this on our questionnaire, they changed it to 15 combined race ethnicity categories. So they integrated this in the questionnaire. So what that looks like is, instead of saying, are you white, and do you identify as Hispanic, Latino? This year they said, are you white? Are you white, Hispanic, Latino? Or are you Hispanic, Latino? And so, and they did it for every single racial group, right? So same question applied for, and you can see there, Asian or Asian American and Hispanic. Those are 2 separate categories this year. And so what that meant was, the main kind of change area that you're going to see is right here, where in 2023, the composition of white folks who are experiencing homelessness was 61%. That dropped to 49%. And it's pretty notable, I think, that the American Community Survey, the census data that we have, says that the composition of white folks in the community at large is 58%. So we actually moved from one side of that threshold to the other, from overrepresentation to underrepresentation, which is pretty significant. I think it's noteworthy. I think we're expecting that this came because, as you can see there toward the bottom, Hispanic or Latino, 12% of folks this year opted essentially to say, we are Hispanic, Latino, and do not identify as any other racial group. So that became an option for the first time, and a lot of people opted to that option. And so we don't know this for sure, but what's likely the case is that folks, given the option, instead of saying I am white and Hispanic, said I am just Hispanic, and that took away from the white category. So anyway, noteworthy. And then you'll see, in terms of the other racial designation groups, Black, African American, or African went up 1 percentage point. American Indian and Alaskan Native went up 1 percentage point. And incidentally, that group also is fairly overrepresented in the community. I think census shows that that's 1%, community at large, 6% now in the homeless population. And then throughout the rest, the only other change that we saw really, I think, is noteworthy is that Middle Eastern or North African is now a designation, whereas before that was categorized under multiple. So not a lot to report. It's a very small group, but still noteworthy that that's something that people could opt into. Just going to show those numbers one more time so you can kind of see the breakdown. And I think bottom line, folks, is that this tells us we still have a lot of work to do. So there we go. Next, we'll go through these quickly. These categories are super important. Subpopulation groups, they're super important. They drive the work that we do. But I will say, in terms of the point in time count, the numbers vary so slightly from year to year that it's, we don't spend a ton of time going over the differences between 23 and 24. Here they are, just to know them, just to see that we have them. I think it's important, in terms of veterans and chronically homeless, we saw those numbers shift significantly more than the other ones. And so those are areas we'll be paying additional attention to, like, why did those change? Is there a reason we can pinpoint as to why those went down in the case of veterans or up in the case of chronically homeless? And then same here. Again, subpopulation groups like these are super important. And we spend a lot of time in our day-to-day work kind of figuring out how to better address all of these issues that folks might be dealing with. But in terms of the point in time count, we don't get a ton of information about why things are changing. This one in particular, people living with HIV/AIDS, pretty big swing. So that's something that we might pay a little more attention to. Okay. Couple things on methods, and we're getting close to wrapping it up and doing some questions if you have any. So just real quick, we shortened the tool this year. We went from 27 questions to 16. We basically reduced it to the bare minimum that HUD requires. So those are the required questions and nothing else. And the goal there was really to get to we want to emphasize that more interviews provide better data. It's a better experience for everybody involved. And it's just something that we want to target for years to come. Like we want to do more and more interviews. Our numbers historically been hovering around 40% interview and the rest observation. So that's something that I think we've just set as a goal. We phased out paper surveys for the same reason and also for consistency. And then we really emphasized our online training to try to kind of standardize what people are hearing jurisdiction by jurisdiction. Now, even with those changes, unfortunately, we saw a reduction in the percentage of interviews. So whether that's because, well, we don't know why that would be. So this is stuff that we need to follow up on and talk to coordinators about for sure. But it also was raining cats and dogs. And so my hope is that some of this is due to the weather. Not everything's due to the weather though. So, but on the other hand, we did more surveys and interviews in total this last year. So, good and bad. And at the bottom, just wanted to note for the first time, I think we've had enough concentration of people using the app that we're able to talk a little bit more about how many volunteers we had. It's difficult to get volunteers, like reporting on volunteers from jurisdictions because people come and go. Different jurisdictions use different methods for tracking who participates. But one thing you can look at is who logged into the app. Everybody uses the app. Who logs in? Okay, then those people counted, right? Last year, lots of people shared the app. This year, we put a heavy emphasis on use your own app. We'll give you as many numbers as you need. It doesn't cost any more money. Just tell us how many you need and train people to use it. So, we handed out 806, 488 were activated, 366 were actually used. So definitely, there was some, there were people sharing apps. I have to assume that, but we have like a baseline number now for the first time. And so we will be in future years, we will be better. We'll be tracking that as well. That is all that we have to report. We wanted to say thank you to all of the coordinators who work really, really hard on this. And of course, to the volunteers and the staff who go out in the field and do this work. And if anybody has any questions, now would be the time.
Thank you, Brian. I'd like to open it up to the board for discussion or comments.
Two quick questions. Can you explain the difference as to why there were 3,738 surveys, but the count for unsheltered is over 4,000? Like, are there multiple, or are some of those like including multiple people, right? I was just curious.
I think that's it. And we could do a breakdown to give you a better sense, like per returned survey, what we're looking at.
I don't necessarily, I was more just curious as to like why that is, but
I don't have a specific answer, but I mean, if you look at the number before that,
yeah,
there was a higher count.
Yeah,
So same issue. And I assume that it's because they'll count a household and it'll be multiple people in the household.
Okay. And then could you just talk a little bit about, and I'm not sure if you know off the top of your head, but like what data did we not collect between since we've reduced the number of questions, what kind of data do we not have this year that we did have last year, like maybe about pets or things like that?
That's exactly right. So one of the questions was, why don't you want to go into shelter? One of the questions was, I think, related to pets. I can bring those to you next year or next month. I don't have them on the tip of my. I mean, I could also pull them up if you want to.
No, I think I'm just curious more as like for the board to consider as we go into the next year, if weighing maybe the pros and cons of this. So this year, it seems like there was some positivity around the reduction in questions, but I also wonder if we go into the next year, if we want to consider adding questions that we do feel like, even though it adds time to the survey, would be pertinent for us to make strategic decisions as a board.
I think the idea behind it was just that our data has never been quite clean enough to make use of a question like, why aren't you going into shelter? Like when you get the feedback from 40% of everyone counted, it wasn't conclusive enough that you would make a change based on that. Right. So, and same with the pet question. I feel like that's part of the problem. You'd almost be better off doing like a sample survey of 100 people and then extrapolating that. Or I think there's other methods that would probably give you better results, but happy to talk about it.
So just for clarification then, Brian, we'll get the two pieces of data that we want to look at, what specifically wasn't asked in terms of questions from the last survey. And then the other follow-up item was just clarifying, I think, the number of surveys that were completed versus the number of households. Is that right? Do I have that right?
Well, that one, honestly, I don't
Good
really
with that
need to
one?
follow.
Okay.
I was just like, my head was trying to figure out the difference of that numbers.
Okay, so then perhaps just breaking down the questions. That were
Yeah,
asked.
100%. We'll bring that to the next meeting.
I'm interested in seeing a drill down of the folks presenting with HIV/AIDS, their ethnicities and some of that background information. Did you say it was an increase of 12% or 21%?
Yeah, you can see the numbers there.
That's significant, and I'm really interested to see more information on that. Absolutely. And if we can discuss that as a strategy, aligning the two.
Thank you both. Any further discussion?
Brian, can you go back to the main chart, like the full pit count chart? One more, maybe. That one. Oh. So I know that you mentioned it, Brian, and we all know in this room that the pit count might not be the best tool to utilize when talking about the numbers of people in our region, but this is, I think, really big news. The fact that our community has invested so heavily in shelter and made some really big improvements in the way we're addressing unsheltered homelessness, and the fact that we did see a slight dip in the number, but that shelter increase is really incredible. And I think we should not do a victory lap, as my colleague Scott Hall says, but celebrate that a little bit. Like that's tremendous for our community.
Thank you, Rachel. All right.
Madam Chair, if I may ask, just
Absolutely.
while we're looking for the data drill down, not just on the HIV component, but if we could see that data breakout on each of the categories. So going back to veterans, which veterans are unhoused still, looking at demographic data, which young people are unhoused. So if we could get the racial ethnic breakdown on all of those subcategories, I think it helps better sculpt intervention specific to the yet to be sheltered subpops. Thank you.
When can you clarify, Brian? Because I think like on this and the other ones, yeah, of understanding, is it a combination of both sheltered and unsheltered, or is it only those that are unsheltered that are included in this and the other breakdown of those that report like substance use, mental health?
So you can see here trend lines. It's a little bit hard to see this, but on the report, you'll see this in better relief, but the orange is sheltered and the purple dotted line is, orange is unsheltered, purple dotted line is sheltered. So you can see, the very least, you can kind of see the direction that they're going. And then the bold line is averages. Mhm. And here we do not have it distinguished between sheltered, unsheltered, and I don't think in our report we will either, but I can certainly follow up on that.
Yeah, again. All right, wasn't mic'd for the record. Again, getting down to what populations are we talking? Young people under 18 are under 24, or the explosion of HIV? Are we talking, or is it more chronic Hispanic identifying individuals? Like really because public health intervention strategies vary by subpopulation. So giving us tools to understand how we educate, inform, and do outreach would be helpful for us at a municipal level, for sure.
So we have that as a follow-up item to drill down and be able to present that information to us at some point. Thank you. All right.
And hey guys, I'm not sure if you can hear me. This is Kent. Can you hear me?
We can hear you.
Oh, great. Hey, thanks again, Kent 40, everybody. Two quick points on the HIV. Teros Health received that SAMHSA grant to do outreach for behavioral health. It was from SAMHSA, and they got priority points for being in an all inside jurisdiction. So they're, I think, up to about 150 folks that they're having a case management, specifically outreach for HIV positive in conjunction with their outreach to street behavioral health. So that grant was initiated in February, and they're already up to almost 150 folks that they're tracking and having case management for. So they certainly, might be a connection happy to make if you all aren't connected with Teros. They also are bringing in more HIV testing within their structure. I did meet with them last Monday. I was in town last week. And then the second point is SAMHSA is doing a 2.0 of that grant. So they did, we're awarded 3 grantees, and 3 of them were all inside jurisdictions. So that was great. And this next year, they just, I'll get the date of the next due date, but they are encouraging, and those 3 can't apply. So there's a next generation of that specific to HIV and folks experiencing homelessness and a behavioral health angle. So I'll put that in the chat so that it's out there for that next grant opportunity.
I'm wondering if that would be like, since the group is interested and there was that, in addition to the data, since Teros already is awarded, has an active program for this, could we have them maybe come to one of these meetings, or even the collaborative meeting, to present on just like how to access those services, what they do, who would and would not be eligible?
Age groups, whatnot. Yeah, that'd be great.
Yeah, I'm happy to make that connection. Like I said, they're super excited about how it's taken off so far just since February. And they've really gathered a lot of information. I think there's on nearly 500 encounters with those almost 150 patients. So yeah, happy to make that contact with Brian and the team.
Thank you, Kent. Right, any additional? Are we ready? Okay, go ahead and move on. Next, John Erlinger will present on work with partners executing a statewide homelessness prevention strategy. And this is in reference to the Garcia Family Foundation homelessness prevention work. John? Welcome.
Good afternoon, everyone. Thanks for having us here today. As you mentioned, I'm with the Garcia Family Foundation. I've been a little bit closer. I've been with the foundation 5 years. Our work is probably 50% in the homelessness space, both from prevention through housing. So we do a lot of work here. Why homelessness prevention? Basically last fall, based on information actually coming from MAGS. So the ratio that talked about for every 10 people experiencing homelessness who became housed, 18 were new people were becoming homeless. Based on that data point, that ratio, we ended up deciding we wanted to move heavily into the homelessness prevention space, particularly because of the impact of that ratio on what we would look at as chronic homelessness, additional people becoming homelessness, the need for more shelter and that kind of work. We've also gotten a lot of requests over the last year or so about homelessness prevention best practices, what people can do, providers asking what can they do to be more effective with the funds that they have for homelessness prevention. So we started to reach out, talk to different people, and ultimately came up with a program with certain grantees, and then also an umbrella evaluation program to wrap that in. So we're putting about $5 million into the homelessness prevention work. About 500,000 of that will be in the evaluation piece of the program. We're using the 3 universities under a group called ASHAC, who's going to do that work in addition to the Action Nexus at ASU. The partners we're using are TPCH in Tucson, so Southern Arizona, Catholic Charities and Flagstaff Shelter Services in Northern Arizona, Keys to Change, St. Vincent de Paul, and Tempe Community Action Agency in Maricopa, and then Solaria will cover the rest of the state through kind of their phone system. For us, the program, so for all those dollars, we have probably about 600,000 going into Southern Arizona, about 600,000 going into Northern Arizona, about 500,000 into the rest of the state, and probably anywhere between 1.5 million or more in Maricopa County. We have some additional funds available to expand upon that, but we're going to wait and see how things go over the next few months as we roll out to see where those additional funds should go. We have 3 pilots going on within this work. One is in Pima County on different ways to collect data to see if we can learn, like, how can we help providers not have to do as much work on the data collection side. And then we're doing 2 pilots with St. Vincent de Paul in the family homelessness prevention space. So really one on, does the referral source make a difference? So today with a lot of those providers, people come to them, they do first come, first serve. We're looking at whether, if it comes from a managed care organization, if the referral comes from a family resource center, from a Catholic parish, from some other places, does that make a difference on basically whether we're finding the right people for this intervention versus other interventions? One of the things I learned in initially working through the work is that what I thought of as homeless prevention isn't how other people think of homelessness prevention. And so really I found that when people use that expression, they were talking about one or more of 3 things. One, which is what I thought it was people at risk of homelessness who are likely to become homeless. And that if with a moderate level of assistance, we're likely to remain stably housed, diversion, and then rapid resolution, with the rapid resolution being somebody who is homeless, had become stable, and then with a moderate level of assistance like move-in assistance would become housed. So all 3 of those tended to be in what people called homelessness prevention programs, and in our work, any of the 3 can be used. Although we expect the majority of it to be in what I call homelessness prevention. We also have a separate project where we're going to bring the data into this evaluation process with UMOM to try to reduce the family waiting list in Maricopa County. So we're having 2 full-time caseworkers that will be working that wait list that hadn't been done before. And they're also testing a new pilot within their shelter of identifying families that they think can get through there in 10 to 14 days to move to housing. As of the end of April, they had 2 families go through, one in 14, one in 16 days successfully. So they're going to be testing that over the next several months, with as well as interventions to help the families on the family wait list. We're partnering them with the universities to look at that data and see if there's more insights around prevention that we could look at related to that work. The evaluation process has basically got a couple of different components. It's going to look at process. It's going to look at outcomes. The focus will be predominantly efficiency and effectiveness. So efficiency, how good we are at identifying people who are likely to become homeless, and then effectiveness, how good are we at identifying people who, if assisted, will remain housed. They'll do both quantitative and qualitative related analyses. So there'll be surveys that will be both incentivized and non-incentivized, and there'll be interviews on the qualitative side that will also be incentivized as well. So we'll look at kind of all of that data in the context of what's working and not working related to the various programs. So with the partners that we're working with, we're not telling them they have to do what they're doing a certain way. We're just saying, do what you normally do. And then we'll use the data to evaluate how everybody works, and then share that information with everyone. So we're not going to do a TPCH does this way better than everybody else kind of deal. We're going to do more of a, here's the things we see that seem to work best, from the data and the evaluation process. We will also be doing quarterly meetings. So we're going to bring everybody together on a quarterly basis. We're going to talk about what we're learning up to that point. And so have both people share what they're doing on the process side as well as on the analytics side. We're going to be running analytics every quarter as we move forward as well. And we'll be getting downloads from all of our providers on a monthly basis to look at the data, as well as the survey data. We expect there to be two cohorts, the Garcia cohort. And then we also expect we're hoping that the grantees for the Arizona Department of Housing $5 million homelessness prevention NOFO will also be part of this process. And that would be a separate cohort with us going through the same evaluation process as everyone that we're funding today as well. And then the final data piece we're working on is we're talking to Family Services in Tucson. They have a 3-year HUD grant to do youth homelessness prevention, and they have an evaluation process built in there. And we're talking to them about bringing their data into our data set to be part of the overall learning that we can provide to everybody. We have a current email list of about over 100 people today that have expressed an interest in homelessness prevention. So as we learn things and are aware of things, we'll share those. The work through the universities is not meant to be research work. We're looking for actionable insights. So it's basically, if these 3 factors are present, we see a very high rate of success. If these 2 factors are present, we see a high rate of failure, that kind of thing. So there's very specific recommendations we're looking to pull out of the work as we do it. And that was something when I did the initial research in this area, I wasn't seeing a lot of that. I was seeing more of, if you do homelessness prevention work, you're 77% less likely to have people be homeless. But it wasn't really talking about more specifically what providers asked me, which is, hey, when I'm getting ready to fund somebody, what kinds of things should I be looking for? And what kinds of things are red flags for me in terms of that work? We're also talking to some folks about trying to do some more upstream work. So we have some of the funding set aside for that. We also have some funding set aside for predictive modeling. Right now, the biggest challenge there is we have 211 data, HMIS data, and evictions data, but we really need more, and we're running that data through the model, but we really need basically a richer data set for that to be truly effective. And then the only other thing I guess I would just share with you is that at this point, I've had several people reach out to me about whether we would have an interest in pursuing kind of a focus on family homelessness in 2025. And so we are starting to have discussions around that. That will probably be toward the end of this month with the first meeting. And with that, I'll stop and take any questions that anybody has about what we're up to.
No, I may have missed it, and my apologies, John. Can you tell me what stage of the process are you in with this right now? What
So
phase?
it's been a little bit delayed,
Okay.
more so than I would like it to be. We should have everybody in play by June 1st
Okay.
and actually doing something. Our first was St. Vincent de Paul on April 1st. And then on the Arizona Department of Housing, I don't think the way their process works, I don't think that their funding would be in play until after July 1st. So that would be probably more going into the first data you would see would be more August, maybe September for them.
Thank you.
Other questions anybody has about anything?
John,
Yes.
let me just let everybody know, John had a handy 1-pager on some of these details. I believe that we sent it around with the meeting packet for today, but also I'm sure we can forward it on as well if you want to reference that at all in the future.
I would just ask that perhaps we could hear another update from you. Once you're maybe September, I'd like to hear 90 days in some of what you're finding out there. And I'd be interested in having another update on the process and where you're at, any barriers or things that you're uncovering.
Yep, no, we'd be happy to do that.
One question on this, John. So, and I know we've talked a lot about this already, but a lot of what you're saying is sort of for information purposes to better inform the practice. Do you anticipate that this group would take on any responsibility and actually hey, we're going to push for standardization around X, Y, or Z, or hey, as a leadership body, we would want to consolidate funds to do more things that are going to be in alignment with the findings of the evaluation, or actions beyond the kind of information and collaboration part?
So we haven't specifically talked about that within the group as to something that would be something that would happen. We did, in kind of getting to the point that we got to, we did end up sharing information with people to try to get some consistency across some of the evaluation work and some of what they were doing. So I think that would be kind of a natural next step I think, TJ, though, that would be based upon kind of what ultimately the findings are, what we actually see. But I think I could see that as a natural next step arising out of that, where it would affect, if you're funding, you would want to see these kinds of things implemented. And effectively that would drive the practice at that point. I mean, I think that just would be the natural next step. Yep. I think over here.
Yes, I was just wondering if you could expand for a bit about your perceived definition of homeless prevention versus the way others see it. And has the Garcia Family Foundation created a standardized definition of how you look at homeless prevention?
So what we did was effectively said the community seems to be talking about these three things when they talk about homelessness prevention. So in our program, any of those three things would qualify with respect to what we're funding and then looking for from the evaluation process. So we didn't try to force that issue. We just tried to identify what it was and then kind of leaned into that, is how I would describe that.
Thank you.
Yep. Yes. I think what we'll see, so for the people where you're in the true prevention space, they're in whatever they're in at that side. On the other two, probably more the rapid resolution side, I think we'll see that kind of information coming through, and we'll see what the impact of those different destinations will tend to be on the people that are being placed. We're not telling the provider that they have to put somebody in any particular place. We're letting them make that call. And then we'll evaluate what the effect of that is and the kind of the efficacy of that choice. So the answer to I don't know really how that's going to work. We're going to find out. Yeah, we're not trying to prejudge things, because we're afraid that's how you don't learn. So, and that's why we also didn't force people to use different tools. And from my perspective, you can look at this a couple different ways. For me, for example, if I were looking at risk factors, I would say prior homelessness would be a risk factor to me. So if I'm looking at the homelessness prevention, I would have a tendency person would score with me probably lower than somebody who hadn't been homeless before. But then if you look at other tools, I looked at a lot of different tools out in the marketplace today, and a lot of tools actually score higher for prior homelessness. So to me, the issue, just so everybody's aware too, my focus is that ratio. We have to reverse that ratio. And so to me, to reverse the ratio means the people that we are helping stay housed needs to stay housed. And so the more likely they are to do that, then I think the more likely that investment is to help switch that ratio. We need to flip the ratio, basically, is my view. And so that also means though, in my world, it's going to not focus, this won't focus on more chronic homeless people. This will focus on people that are less acute, just by definition. And so that could be good or bad. I think my view is if you can flip the ratio with these dollars, that does more for people that are chronically homeless than almost anything else I could do, because that should free up beds and resources. So if we can see if that works. Now we'll find out. Maybe I'm completely wrong about that. But we're going to find out. We're testing it.
Yeah, and I would just say to balance that, like the other side of that though is there's been research that even the board I think has looked at in the past that shows the first come first serve without any focus on any risk factors also does not have a strong correlation of actual homeless prevention. That it was like there are lower percentages of people who actually would have been homeless regardless. And so I think the challenge with this type of work is like finding that balance of how do you find where you're not targeting resource to somebody who's like chronically homeless, who you throw $1,000 at, and then they're going to end up right back in the system. But at the same time, you're also not throwing $1,000 at a individual or family that would have avoided the situation altogether. So it's like, how do you get enough information to find this person would have been homeless without assistance, but then would also be stable with that assistance? And so it's I'm excited to see the findings of some of this so that we can, as a community, better recommend things for sure.
Yeah, and our interest in statewide is we anticipate that there could be some differences both in outcomes, but also even dollars spent. Like we know right now that in Maricopa County, you're going to spend more than you are in Pima County or rural. And so we're going to get a better chance to see, is it just proportional? Like I spend less, but I get similar outcomes, or is there something different that goes on there? And then we want to look at the entire context. So we're looking at all the data that's coming in to also see, are there other factors that are affecting this, including whether just how you do it, if that makes a difference as well. Because we think that's a possibility, which to be honest, I wasn't thinking about process when we started. The university guys brought that up. They made me do it.
Just a quick question. You did mention this isn't going to be a rigorous study. Is that correct? A rigorous research study? And if so, what are you ruling out in terms of confounding variables for this study in the regional aspects of what you're doing?
So what I think about when I think about your question is basically when I'm trying to decide efficiency, like are we really picking people who are likely to become homeless? That's generally requiring kind of A/B control groups as you do the work. I believe that with if you have providers that are budgeting their dollars, you will have kind of built-in control groups, because you'll always have people each month that they could have funded had they wanted to, but they cut the budget off. So if you're there the first 2 weeks, you get funded, the second 2 weeks you don't. And so you have an automatic kind of control group that comes up because of that. We have a few like that. We're also talking to people about creating control groups by continuing the work after they're out of funding and identifying people they would have funded, to try to get enough of that so that we can at least have some degree of confidence in kind of how well we're doing. But we'll see how that goes.
Thank you.
Other questions?
John, will you please thank the Garcia family for us for their
Yes.
generosity and their interest in this work? And
Yep.
there's lots of things they could be investing their money in, and we're very fortunate that they have included homelessness.
I will do that.
Thank you for your
Okay.
time.
Okay,
Thank
thank you
you.
guys.
We are going to be moving on. Item 6 will be passing on, and we will actually move straight on to updates on staffing and events. Brian, Kelly, whomever.
Yeah, that comes to me. So we were just going to mention in terms of the board membership, I think everybody is aware, we lost a board member because she's no longer at CAS. Lisa Glow just won't be on the board roles anymore, and we wanted to make that public. In addition, MAG will be losing 2 members of its team, specifically our team and here in Homeless Services. So Kelly Williams, she got a new job. She's gonna be, what is it? The rodeo, right?
Yes, and to be clear, nobody died. You're making this sound like.
Yeah, well, I feel bad about it. But so you turn your mic on, Kelly.
I have loved working here. Homelessness is in my heart. I very much enjoyed the opportunity to work with you all, and I'm going to County Health, so hopefully I'll be able to answer some of those HIV/AIDS questions for you. Our paths will continue to cross. So thank you very much.
Haley Owens is also taking a new job. She's going to go be chief of staff up in Council District 3, I think. So she's a boss now, and she's going to be even more of a boss then. We're going to miss her terribly. So more updates to come as we fill those positions. And then we wanted to make sure everybody's aware about the just a reminder, National Alliance to End Homelessness is doing a big conference in July. I know those tickets are sold out. They sell out in 48 hours ish. That's so quick. Anyway, that's happening, and you can also almost always tune in to those sessions online and make them available pretty regularly. And then, so the last thing that we wanted to mention, kind of under updates, we don't have a real formal presentation on this yet, but I think would like to see if it warrants one. Some very smart members of my team had a conversation about this, and we kind of thought it would be worth sharing with you all. Other communities have a thing called a governance committee or collaborative. And the charge of that committee tends to be things that are structurally related to the COC. And it's that committee's task to go out and research those things, come back with proposals, and so forth to the board, recognizing that the board doesn't always have a standing body that does those things, doesn't always have time or wherewithal to have like really in-depth conversations about some of those issues in board meetings. And so this seemed like a useful thing. A couple of questions have come up just in the last few months since I've been here. TJ, at one point you asked about like an evaluation of a collaborative applicant. That requires some research. So Mag is happy to do that research and bring it back to the board. But, I also think that there's value in having other folks in the community have those types of discussions. So was curious just to know if this is something that members of the board would find useful. And if so, we would be happy to go and put together a proposal on who would seat that, how many people that might comprise, what would be some of the tasks to include in the charter for an additional collaborative. Any thoughts on that to share right now?
I was just gonna pipe in that I like the idea, but Brian, could you go like a little further into depth, like what you think the group might do?
Yeah, another thought that we had was just that, MAG has, so just keeping with this example, who would evaluate the collaborative applicant? Would you go and get a third party to do it? If so, how would we pay for that? Right. And so there's money for things like that. There's a planning grant budget that has funds for consultants and things like that. But, we don't typically have like a budget setting session in the board, at least that I'm aware of. And so this is the kind of thing that this group could sit down and say, all right, we have, $12,000 or whatever, $20,000 available this year. And here are priorities for consultancies throughout the year, or we don't have money for that. So this group is going to do the evaluation. Or whatever, things like that. And then I think more broadly, you could have conversations about, we had a conversation a little while back about advocacy work. So if this group isn't doing advocacy work for one reason or another, who should be doing that? And again, I think that ultimately those decisions have to come back to the board, but at the moment, MAG's having conversations about that stuff. And I think other folks are having those conversations offline, I assume. But there seems to be some value in having members of the COC as an organization having a concerted conversation about some I think, system structure issues and then bringing those back to the board.
Yeah, I mean, I think it'd be at least interesting to hear like in more detail and for us, like if you're hearing from staff and then from us, like what would be incorporated into the scope specifically. So if it would be like, this group is going to be then responsible for doing like the scorecard review and like stuff like that. If they're going to be the ones handling like evaluations in general about or around systems things, if they're, I'm not sure all of the things that would go into it, but like I would at minimum be curious because I do think, yeah, when we had that conversation, at least about like the evaluation of MAG, like obviously that's an awkward like thing for MAG to be responsible for taking the next step on. So I think, yeah, if, for things like that, it would make sense, and I'd be open to hearing about it from my perspective.
I just have a clarifying question on that. Is, would the ideas and the information be provided to the work group? Would the work group themselves make the decision on the scope of what they wanted to focus on? What would that look like? Or has that been envisioned yet?
I would say probably the board would set the agenda for the next 6 months or for the year. And then this group, their task would be to go and develop a budget around these things or to come back with a work plan for these, these other things. And, and one other thought, right, is that to the extent that these conversations happen offline, like, hey, how should we handle this thing? I think that number one, there's value in having like a smaller conversation group. Also, that group can do research and make phone calls and call people that they know and things like that. And I mean, essentially MAG is doing that, right? We got Natalie over there calling every COC in America, literally a dozen in the last 2 weeks, to talk about coordinated entry stuff. Just like, hey, how do you structure coordinated entry? Because it'd be interesting to know if it's big, it's little. And, as we're doing assessment tool changes and things like that, we figured it'd be good to just make sure that we're not straying too far away from that. Also, she's going to be involved in the coordinated entry collaborative. So, but who has time for that, right? To make a matrix and then like call a bunch of cities. That's, I think, where a work group that can really focus in on, broadly on structural issues makes sense. I don't know if that answered your question.
Is this for like a vote or something, or are you just soliciting feedback?
I think feedback. I don't know that we need a vote. It would just be, I think the vote would be if and when the board thought it was a good enough idea to put it to a vote, to create it and put it in the charter, then that would be the vote. But so for now, what I'm hearing is that there's at least a few people who'd be interested in seeing like a scoped out version of this.
I would support that.
Okay, we'll work on that.
Thank you. Let the record reflect Cricket giving an approval and a thumbs up.
I turn my mic on, off, on, off.
All right, thank you very much, Brian. All right, next item. The next item is a request for future agenda items. Do board members have any other action or discussion items for future meetings?
I think just going back to what we talked about earlier in the meeting of Taros presenting would be really great.
Thank you. And I believe we already have the data follow-up from the point time count that we're going to do as well. Moving along. Next item is board roundtable. I'd like to open the floor for a roundtable of announcements, events, challenges, anything that you want to address or any opportunities to come together for a new idea. Do any board members have any ideas or anything they want to share? No updates? Sure. Oh, okay.
I've got some
Ken,
updates.
please.
So for Tempe, first, so I'll lead with announcements. So Dr. Paul Bentley, who's been in charge of our social service area at the city of Tempe, is retiring. He's going to work at ASU and start his second or third career. So we wish him the best. He'll be with us through the end of June. So that job posting for deputy director of, so I'm taking this opportunity to do the commercial. The job posting for deputy director, City of Tempe Community Health and Human Services over the social services is up. If you're perusing the website, you'll also notice that there is a deputy director for community wellness and empowerment, because we fused our education, career, and family services department and community health into our larger social service array, and we'll be hiring a deputy director over that area as well. Tempe's getting ready to do, we do 2 counts per year. We'll do a June or a July count. We've kind of punted it out to July to work with our volunteer corps. So we'll of course always share that data back up with you all. And we continue to have the growing, very public challenge of public feedings and unsolicited, I'm trying to think of the term there, unpermitted services in our public spaces and parks. So if there's any collective action in the community around how people approach, because we've called regional agencies and no one touches the, we can get no helpful response from entities you would think that would intervene in the feeding of people publicly. So it's kind of left to, oh, that's a homeless thing. So you all deal with that in the homeless space. So we're looking for thought partners on how do we thoughtfully intervene and make sure that services are being provided in a way that provides for the well-being, that we don't just have people come and drop off 40 boxes of food and leave, and then leave masses and messes where other people can't access space safely. So just again, that's been a growing thing. And so we're still looking for thought partners on that.
Thank you, Tim.
Tim, can you give us a little more insight in who the groups are? I mean, what are they faith-based groups? Do they have like a theme of who these folks are that are coming out and trying to feed?
Yeah, so we have a mix. We have some well-intentioned nonprofit partners. We have some faith-based partners as well. Curiously, none of them are actually based in Tempe, but they are coming to the space to provide, again, what they believe are their core mission services in a way. But what we have is the after-on effect that now makes the community turn against homeless services, because we're bringing 100 to 200 people from different areas into a neighborhood park for a 3-hour, 4-hour event. Everybody else goes back home. Those people stay in that part of the community. And it really has created an uproar from people who were for decades actually pro-human service advocates, but they now are moving away from that standpoint because they are seeing their public services impacted. Trying to be very delicate in it. There's some active lawsuit and things that's not yet to be adjudicated. So I'm trying to keep my comments really tight on this. But so again, we're looking at how do we help folks we've been trying to redirect everyone to, look, if you want to feed, we know that our nightly rotating shelter I help program does not have enough people to feed, help them with food every night. We know our shelter, we provide food boxes, but if you want to come provide a hot meal, come here. So we're trying to redirect people to plug into services and systems, but there are a subgroup to say, we prefer to do the guerrilla style, drop and roll. And what it's leading to is a substantial amount of left behind drug paraphernalia, unsafe situations in public parks that are now starting to spill over into neighborhoods, which again is just turning the support for services in those parts of our community, which is not something we can afford as a community. We need all the support we can get. So again, it's looking for that balance and how folks, and still being relatively 13 months into this community, learning the landscape and who's who and who's doing what. So again, always looking for thought partners on that.
Thank you. Anyone else have any other announcements or anything that they would like to share as part of the roundtable? I would just like to wish Kelly well in your endeavors, and I do definitely see how there is can be a stronger interface between public health and what you know here and what we do. So I look forward to to things that we'll see in the future. And Haley, I wish her well in her new endeavors. How exciting to work along council member. All right, if there's nothing else, board meeting is adjourned.